Welcome everyone. Welcome everyone. I'm Mosmi, and on behalf of Grifin Publication, I welcome you all to the grand launch of Doctors No Less Than Gods, Those Hands That Heal. So today's event is not just our book launch, but it is our tribute to our very own Dr. Nilakanta Siva sir. So at the very onset, I request our esteemed guest and all the co-authors to maintain silence of just 1 minute, bowing down and praying for Sir Nilakanta sir. Thank you so much, everyone. Thank you so much. So at the onset, I also welcome Rajadhyaksha ma'am, the soulmate of Nilakanta sir. She's not able to join, but she has conveyed all the wishes to all of us. So late Dr. S. Nilakanta Siva sir, the editor-in-chief, was a retired nuclear scientist, was an optimistic and successful cancer conqueror with no inhibitions in ascribing his bladder cancer to his tobacco addiction of the past. And with an avaricious appetite for credible and reliable medical information, both he and his wife, Rajadhyaksha Siva sir, have dedicated themselves to the task of spreading awareness of life after cancer with over 24 publications to their credit. After compiling the stories of this book, Sir handed over the responsibilities to his co-editor, that is me, Mosmi, and he left for his new home in heaven. So Doctors No Less Than Gods is an anthology celebrating the existence of those hands that heal, our doctors, our health workers. So today we have, very special people with us. We welcome Dr. Sadhana. Dr. Professor Sadhana Kala is a USA-trained robotic and laparoscopic surgeon. She is a trained fertility specialist, National Icon Endoscopic Surgeon of India, and Icon Endoscopic Surgeon of North India. She was the university topper, winner of several gold and silver medals and certificates. And she is the awardee of CL Javeri and PN Well Awards of Indian Medical Association for Professional Excellence. And currently she is emeritus and currently senior consultant gynecologist and laparoscopic surgeon at Mulchan MedCity and Apollo Cradle Hospitals, New Delhi. She is also a published writer on varied topics. So welcome, Sadhana ma'am. We could hear you before the program started, but we wish to hear you again because our program is recorded now. We have with us our special guest, Dr. Anup Rajadhyaksha. He is MS Ophthalmology. Hope I'm pronouncing it right. He's the medical director of Nandini Eye Care Center, Jogeshwari and Bandra East Mumbai. And he has been in practice for almost 30 years now. He is a man of great opinion, and we can read him on all social media platforms. He is a wonderful writer too. We also have with us Dr. Rajeswari Sita Raman, lecturer, author, certified translator. She is from Malaysia, and she is a wonderful poetess. She has innumerable poems to her name, and she works for the Ministry of Malaysia. I also welcome all the co-authors of Doctors No Less Than Gods. And if Sadhana ma'am, if you can hear us now or hear me, so we wish to listen to you now. Ma'am, can you hear us? I do not know if she can hear. So we go to Dr. Anup. Dr. Anup, I welcome you and I heartfelt thanks for your presence here.
Thank you so much.
Sir, all over to you. What would you say today? It's a tribute. It's a launch of a great book. So all to you. We want to hear you.
Yes, absolutely. And thank you so much for inviting me for such a wonderful occasion. First of all, prayers to Dr. Siva's soul. And yes, I agree. Also, I heard the earlier person say, and what she said is right, that honestly, we are not God. We are just human beings doing our job every day. There is a saying which I heard somewhere, which is very important, and you have a lot of people who have gone through this trauma, like he did, is that doctors save people whom God wants to save. And I have seen that in my own life also, and I've also seen that in my practice also, where we see a varied amount of patients. I am an eye surgeon, so I essentially stick to only my part of the profession. But we have seen miracle cases that do happen, wherein when we can see that this patient has not much choice or may not do well, and they end up doing very well. And one thing I would like you to say that after all these years is that patients who do really well are they have two things. One, they have a very positive attitude that they will do well, and also they have a lot of faith. They have a lot of faith in their own healing, and they have a lot of faith in their doctors. When this combination is there, most of the time it is unbeatable, and most of the patients really do well. Because even in your life, you must have seen where you think that this patient will not do well, or this person is ill and is not doing well, suddenly do very well. So I really feel faith is one of the main thing that really, really helps. So have faith in your doctor, have faith in yourself that you're going to heal, and I'm sure it will work out. So thank you so much for inviting me for such a wonderful occasion. Thanks a lot.
Thank you so much. Thank you so much, sir, for your enlightening words. So let me tell you, this book is a union of all health warriors and eminent writers to express gratitude to their services and be proud of their profession. So I have requested Dr. Sadhana to speak now. I have just sent her a message. Hope she speaks. Let's wait for 30 seconds because her audio is not working.
Maushmi, can I say one word before
yes, sir.
I'm
yes,
sorry.
Sir, more to talk. Yes, sir. We are here to listen to you today.
Actually, to tell you the truth, I'm sure there are other doctors also who are in this thing. And I tell most of my junior doctors, I have done a series of mentor series for young ophthalmologists during the lockdown. And my first thing was the God phenomenon. I'm sorry it goes against the what our topic is today. But I keep saying, tell the doctors at least that don't think that you're God. That's the first thing that you should remember, that you are not God. You are human as everybody else. Okay?
Clearly, I understand.
Thanks a lot.
I understand. So we go to Dr. Rajeswari ma'am. She's from Malaysia. So whenever Sadhana ma'am cannot hear us, she can see us. All right. So whenever she speaks, definitely we will, step back and will allow her to speak. So we know. Thank you so much, Rajeshwari ma'am. You're here. She's from Malaysia, and thank you so much for taking out time and joining us. Yes, ma'am. What do you say today? What do you have to say today?
Thank you very much. My warm greetings to the Managing Director of Grifin Publications, respected Mausmi Sachdeva, our special guest, Dr. Sadhana Kala, Dr. Anup, Dr. Madhulika Banerjee, dignitaries, co-authors, renowned doctors and friends around the globe. A very warm greetings from Malaysia. First and foremost, before I proceed, let me express my heartfelt appreciation to Grifin Publications for the opportunity rendered to share the space with eminent doctors and my views on the dream book of late Dr. S. Nilakanta Siva entitled Doctors No Less Than Gods. I'm not a medical doctor, but I'm a doctor of philosophy, but my children are medical doctors. So I feel they wear multiple hats. To me, doctors are scientists. They provide information with the latest treatment methods for rare disease. They are also counselors who gently advise people on healthy lifestyle. They are philanthropists who treat the poor and weak at low cost. They are messengers created by God to heal patients and save mankind. They are also philosophers who come out with strong philosophy to energize people. So these are the roles played by doctors. And I find all this in this single book entitled Doctors No Less Than Gods. And I find the style of writing is commendable. Expressions are profound and engaging based on real life experiences. Through this book, one can identify the areas of life that we need attention, we plan our action, and we transform our life to a more balanced and productive life. An uplifting book suitable for all age levels, gender, and social status around the globe. A thought-provoking book not to be missed to track our progress on health from time to time. Heartiest congratulations to Grifin Publications in fulfilling the dream book of the late Dr. S. Nilakanta Siva, and may his soul rest in peace. Om Shanti, Om Shanti, Om Shanti. With that, thank you very much.
Thank you so much, ma'am, for your gracious presence here and for your kind words. Before we go ahead, I do not know, we are still waiting for Sadhana, ma'am, but let us release the book so that our co-authors can also share their views and we can have a healthy conversation today. So,
can you hear me?
yes, ma'am, we are
Can
waiting.
you hear me
Oh,
that
thank
side?
God. Yes, ma'am, we can hear you.
Okay.
Finally. Ma'am, so we want to hear you now. We could not hear you at that time. The program is recorded now. So we welcome Dr.
Yeah.
Sadhana, ma'am. We have already given
I am
Dr.
delighted
Sadhana's introduction.
Be on the panel for the launch of the book. The most important thing is the topic. And when I saw the topic, I was thrilled. But he has chosen a very good topic. But the only thing is that we are not God. We are actually the caretakers. And the way he has started the book and Mosimi has given a final touch and everything, it's amazing. And as far as the doctor, the book is edited by late Siva, and later on, Mosimi has done the job. But actually, doctors study the whole life to save the life of the patient. In medical school, it's all science on the body. But later, it's become a diagnostic and evidence-based medicine. But still, I feel it's a science. But the doctor, when he treats the patient, he shouldn't treat the lab reports. He has to listen to the patient. So the listening ability is very important, because once you listen to the patient, you can diagnose half of the thing. So with these words, I'll just give a good wishes, and I'm congratulating Mosimi for the book. I think the book will do well, and my all wishes are with you.
Thank you so much, ma'am. Thank you
you.
so much for your presence here. So here we are launching, this is the release of Doctors No Less Than Gods. I think we all have our book in our hands, the co-authors. So Dr. S. Nilakanta Siva, sir, Rajadhyaksha Siva, Madhulika Banerjee, Dr. Madhulika Banerjee is here with us. So Shalini Samuel, Amruta Ashish, Dr. N. Raghav, Dr. Bhavani Chandrasekharan, Aarti V. Karanam, so Dr. Lavanya, PC Ashwarya, Dr. Supraja, Anjali Jha, Geeta Nambia, R. Kritivasan sir, Ranjan Mehra sir, they are here with us, Sushmita Chakraborty. Thank you so much and heartiest congratulations everyone. And without you, this book wouldn't have come up. So this book, the credit of this book goes to all the co-authors. So I hope you all have the book. And once, can we have a round, we have a good clap and round applause for this book, for the success of this book. Can we hear our claps? So here it is. We have released it finally. And a few of our co-authors are here with us today. And special thanks to, I call her Kala, all right? So we'll listen to her when she speaks for her contributions in designing the cover page. It was a dream project of Nilakanta sir, and his dream was that, yes, Kalai will design our cover page, the next cover page also, and she did it wonderfully. Thank you so much. So we have with us Dr. Madhulika Banerjee. Yes, what do you have to say? It's a wonderful moment for us.
Thank you, Moshimi, for making me a part of this. So a very good evening, everyone. I'm Dr. Madhulika from Kolkata. Actually, today is really a very precious day for all of us. A day dedicated to Dr. Nilakanta Siva sir and as well as Rajadhyaksha ma'am. So as I always say, gone from our sight, but never from our hearts. Shiva sir was actually a true fighter, and it's a proud moment thing for me that I got the opportunity to work with him as a co-author. And to be very honest, even ma'am is a warrior who always stood beside sir, and both of them dedicated their whole life for all the cancer fighters. So yes, he will be missed and remembered forever by everyone. And finally, a big thanks to the Grifin Publications and the best editor, Moshumi, for making sir's dream come true and bringing all of us together over here. Thank you so much.
Thank you, Dr. Madhulika, for your wonderful, contributions to this book. So we'll come back again. We'll listen to one or two lines which you have written, in this book. Definitely.
Sure,
so we come to Amruta Ashish. Amruta, ma'am, I hope you are here with us today. Hello. Yes, Amruta. Today is a wonderful day. All right, what do you have to say? Finally, we have released it. You all were waiting and asking me questions, Mosmi, when is the book coming out? Will it ever come out? And we were sad also because sir left us suddenly. So finally today we have released it.
We are eagerly waiting for that book. Na? That's why I'm asking you, ma'am, when the book will be launched. Sorry for the trouble.
So what do you have to say today?
I just want to say thank you to Nilakanta Siva sir because he gave me that opportunity, and so that I can express my feelings for my doctor, which is my adopted. You may say my adopted father, and I also gave tribute to Corona warriors in this book. That is also great experience for me. I can give this is a very cute way to gratitude for all the doctors, and only because of Nilakanta Siva sir this is happened. So very thank you, and thank you so much to you also, because finally you complete all the project and all the tasks. It is very difficult. I know.
Thank you, Amruta. Thank you so much. We also we have with us Dr. N. Raghav. I do not know if he's present with us today, but we have we have R. Kritivasan sir. Sir, can you hear me? R. Kritivasan sir.
1 minute, can you hear me?
I can hear you, but I cannot see you, sir.
Because actually I am walking. I had to attend the patient and I am just back on the towards my home. That's why I had not switched on the video. Shall I on it?
Yes, sir. We need to see you, and the program is recorded.
Okay. Okay. Anyway, can you hear?
Yes, sir. Yes, sir. Yes. What do you have to say today? Today is a wonderful day. We have released finally our book.
Yes, my thoughts are I had three things in my dream project. One is this Ostomy book. That is the earlier book which of my teacher sister Saroja. That was her dream also because no Indian authors had ever published a book on ostomy management from an Indian perspective. That was the first book that has been launched, and on that book, only Nilakanta Siva initiated the things, and he set the ball rolling, and he brought out the book in a very nice manner. And we had a glitch in the finally. Everything got nothing was in the computer. Everything got erased. I got panicked because I have to type everything again. The typing them and again adding the pictures and all is a very hard task, which we cannot complete within the stipulated time. But fortunately, he sat down throughout the night and brought out and recovered the hard copy. That is the thing on the word file, and that is one of the major achievement in my life, which I consider. The second thing is we had Dr. Chandramohan. Dr. Chandramohan is Sister Saroja's almost, he is like her son because he is also studied in Stanley Medical College, where sister was also there. He is a very wonderful man. He is an expert in the upper GI tract surgery. He also took a lot of concern on the book. He helped us a lot. It said that you have to add this one, that one, everything and all he contributed. And he was the one who also came to the meeting of Ostomy book. But unfortunately, we lost him last year. That is before Nilakanta Siva sir passed away, he passed away. That is one of our greatest loss. And I wanted to bring out a memory out of him because in the doctor's field, it is very sad that today's competition is has become so filthy that people are not seeing other people as people itself. No doctor had come out with his Chandramohan's contribution to the medical field is very huge. He had pioneered many techniques and he had patented many things, and he had taught his students also to successfully construct these hernia surgeries. In hernia surgeries, he is an expert, and also in esophagus reconstruction, particularly for patients who consume acid in an attempt to suicide. Those people, they had their esophagus reconstructed and they were able to lead their life comfortably. In that, he is an expert. And also, we had a patient who had almost had a very difficult lifetime on his ileostomy. He had this that is worsening condition called this gangrene on on the stoma site. I just couldn't recollect the technical name immediately. That's a life-threatening disorder. The only thing available is we have to relocate the stoma. But asking him to go for a resurgery is very difficult because his age, everything is and all is a concern. We approached Chandramohan, sir, this is the problem. This patient is having this. Can you take up this case? He said that it's a very difficult one. Anyway, I will try. I will give my best. Don't assure him that everything is okay. Anyway, I will try my best. If something goes wrong, you should not scold me. I told them, sir, the suffering is much greater. Anyway, if you could save him, that is that will be the very great gift for his life. He took up the case and he successfully relocated the stoma, and the patient recovered and he is now doing well. That is one of the very great achievement which I had seen live in my case. Therefore, I wanted to bring out gratitude, a sense of gratitude to Chandramohan. Therefore, I just wrote what all I know about him in that small essay. And we will be presenting this as a gift to his wife very shortly with the sister Saroja. Once the book is released, I have got the copy with me, and I will be presenting it to her as a mark of our gratitude from our side. This is what I wanted to say.
Thank you, sir.
Thank you.
Thank you so much, sir. Indeed, indeed. Doctors, we have words fail when we and sir, I would read out, sir's words only. If there is one lesson that the pandemic has thrown up, it is about how much patients owe their doctors beyond the billing and material compensation. More than 24 patients, doctors, and at-home caretakers have shared their exceptional experiences with their doctors to acknowledge the debt of eternal gratitude, beginning with tributes to their fathers of three streams of medicine. So this book entirely, we are celebrating the existence of doctors. So we have Rajan Mehra sir with us. Rajan sir, you have been working with Nilakanta sir since a long time, right? And you have contributed to his books before also. So today, finally, we have released his last. I won't say it is his last book. We will continue this tradition. So what do you have to say, sir?
First of all, Mosmi, good evening and good morning to all of you. I would like to congratulate you, especially the Grifin Publication, the hard and sincere Mosmi. She had a desire, she had some dedication, she had some determination to open her publication. And wow, fabulous work. What to say about Nilakanta Siva sir? A man of words, a man whom I would like to touch feet. So much to learn from him. And I would like to also to congratulate the co-authors and also say a big thank you to the chief, all the guests, especially Dr. Sadhana, Dr. Anup, Rajadhyaksha ma'am, and all the audience. Without the audience, nothing is possible. What made me write, that was something long time back. But I was totally fascinated by Nilakanta sir. He used to call me, he used to WhatsApp me, and I was touched. And of course, precisely, you all have done fabulous work. Keep shining, keep smiling. And the Supreme Father is always with you. Thank you so much. And once again, many congrats.
Thank you so much, sir. Thank you so much. So we have, I do not know if we have all the co-authors today, but we have Kalai. Kalai, we want to listen to you, your discussions with sir, and finally coming up with such a beautiful cover page. Yes, Kalai.
Yeah, good evening, everyone. I'm so glad and delighted to be a part of this wonderful event. First and foremost, thank you so much for mousing me to, make the project a success and get the books published. I know Siva sir for the past 4 years, and this is the second cover design that I have done for his book. And I'm very thankful to him because he has inspired me in so many ways, beyond the kind of creative freedom that he gives, the discussions and feedback. He is very open. I always feel like working with the youngster because he's always open to new ideas and to, experiment with the work. He doesn't really go by the traditional way to approach things and get it done. I really miss that he is not with us in the physical world, but I'm sure he will always be in our thoughts and memories. Congratulations to all the co-authors of the book, and I hope and I'm confident that Mausami will continue to continue with the mission of sir, and I will also be there to support you in whatever ways. Yeah.
Thank you so much. Thank you so much, because yes, sir, had many dream projects planned. He had more dreams of such projects to spread awareness and knowledge. All right. And together we are working a lot for the cancer patients, their families, caretakers. As in so many years, we are working together. All right. For spreading awareness, to spread an awareness among all. And I'm blessed that I am his first editor, his first book, Zindagi Rewind. So So we met him. I met him through Zindagi Reminds. So he says, you are my first editor. And he never left me. And you can say he supported me. And I kept on editing his books and dozens of books, you know. So definitely, I assure you that this tradition would be continued. So coming back to Dr. Anup. Dr. Anup, so when we say about, pandemic, we have really come to know that we really owe a lot to our doctors. Dr. Anup, what do you have to say?
Well, the pandemic took all of us by surprise because in these modern times, we never thought that we would ever see a situation like what we have been through in the last 2 years. I would say it took everybody, not only the doctor community, but other healthcare workers, the government, and everybody by total surprise. And what I would say, the way our country has dealt with it, the way our people dealt with it, and even the way the government has dealt with it has been absolutely superb. Things could have been way worse than what they were. But the way doctors reached out, the way the healthcare workers reached out, and also the way the people reached out to help each other has been absolutely exceptional. You know, I have friends all over the world, doctor friends, other people, and I've seen the way things have happened in the so-called most advanced countries on the planet, and I've seen the way things have happened in our country. And I can only speak about Mumbai, as you all know, is one of the most crowded cities on the planet. And what we were scared of was the scenario would have been something like a Armageddon scenario, especially in Mumbai. None of us can say that we cannot get affected with the crowd or the way people are jam-packed in the city, but the way people helped each other out and the way everybody rose to the occasion, including our much maligned Bombay Municipal Corporation. The model was actually copied later by most other places also. But honestly, I felt it was a real great team effort on everybody's part. Everybody pitched in. WhatsApp was a great boon because we were reaching out to people through WhatsApp, speaking to them. I was helping out a family in Pune, which I had never met in my whole life. And I don't think now they have emigrated to the US. We are still in touch. All we could do is just give a little bit of advice and try and see through our colleagues in that city if they can be helped with. So I feel honestly, it was a huge team effort on everybody's behalf, including the patients or the people basically who really helped each other out. And we have been able to come out pretty successfully, if you ask me, compared to the other nations, in spite of all our dynamics and economics also. I think we have done a pretty good job. So I really would say that I would congratulate everybody in this effort. Yes, doctors are there because it's a health problem, but there are other logistics to it also. It's not just
we owe a lot to the doctors. Dr. Rajeshwari, Rajeshwari ma'am is here with us. Ma'am, now as your children are into medical profession, you are a writer, translator, you are working for a Malaysian ministry and all, but there also, every country got affected. So your children being in the medical profession, how do you feel today?
It was their choice to be medical practitioners, and my daughter especially, she was in the pandemic hospital. Okay, we have special hospitals during the pandemic, and she was placed there. So as a parent, it was, there were days she never slept. Okay, they were working around the clock, 20 hours, 24 hours, at times 48 hours. And I only met her about twice in a week. So that part, it was actually like heart-wrenching as a parent. And she was also affected by COVID because, and that time the vaccination was never introduced. And being, dealing with patients, twice she was affected by COVID, and my husband was also affected by COVID. I feel that this pandemic is actually an eye-opener to each and everyone, not only in Malaysia, but around the globe, because that's where you can really see the real unity. So that's the time doctors everywhere, okay, irrespective of gender, religion, race, all for one mission, okay, to curb COVID. So that part, I feel that they have done the part very well, and Malaysia was out from pandemic in a very short span of time. And after the vaccination now, I think COVID still exists, but I feel we are able to sail through. I mean, it's just like a normal, like a cough and, like a flu, and it's okay. And we are not, it's not a must to use a mask now, unless you are in a building. So I feel pandemic has really given us an opportunity to learn more on life.
Right. Thank you so much. Indeed,
Welcome.
indeed. We will remain forever grateful to our doctors. And it's not only pandemic, in every situation. So Dr. Madhulika Banerjee has written, being a doctor is not an easy task, not an easy task to wear all-time face mask. They go through so many risks, but still they walk with a brisk. Yes, Dr. Madhulika. Can you throw light on your article or your write-up? Doctors, the white coat soldiers. Wonderful title itself. So what have you portrayed here, like in your write-up, in your article?
Actually, I have mentioned a very short phrase that you have already spoken about. So it's, yes, absolutely true that even after going through so many hurdles in life, the doctors still walk with a lot of confidence and strength. So yes, being a doctor is not an easy task, and they are the lifeline. And the most important thing is that today they are getting harassed a lot. So this should be, this should be not should be a profession at all. So this is not easy to prevent bullying and harassment in the workplace. So this should be avoided mostly in all the hospitals and in private places.
So what's the best line in your article which you read? Like, doctors, the white coat soldiers. So which line or which paragraph do you think, you really, let yourself out and you feel that paragraph or that line is very special to you?
Yeah, that's the phrase. Because I've written of my own, that is the phrase that being a doctor is not an easy task.
And really, being a doctor is not an easy task.
Not an easy task.
Thank you so much. So, yes, I do not know Dr. Sadhana ma'am is here or not, but we have our guest listeners today. So, I can see Adhir Mathur sir also. So, do you have anything? So, each and every individual on this earth, have faced the situation. And I think each and every individual on this earth requires a doctor. So, we have our guest, Adhir Mathur. So what do you have to say, sir?
Yeah, thank you
Today
so much.
We are paying, yeah.
Thank you so much,
Yes,
Mosami, for the invite for this book launch. About myself, I spent close to 38 years in the pharma industry, and I've seen medical practitioners very closely, the way they work and compassionately for the patients. So in my opinion, they are the actually saviors of the humanity. That's how I look at them. And this book is a tribute to the medical fraternity from that angle. So wishing this book all the success as it gets released today. Thank you so much, Mosami. Back again to you.
Thank you so much, everyone. So, Rajan sir, what do you have to say? You are sitting in Delhi, I suppose. Delhi was affected so much, we can see out people. And what do we have to say today when we are paying our gratitude to our doctors and finally released? So before we wind up our event, so few lines from each of you so that we can celebrate the day in the name of doctors. Yes,
I have Mosmi, I have no words to describe, words, lines, sentences, I have to write paras to describe those people. They have their family. They are like us only. They are like humans. They have some emotions. Like, see, today is Mother's Day, the biggest day. My salute to every mother.
Thank you, sir.
And as I'm listening, Dr. Rajeswari ma'am, she was so courageous and bold to send her daughter. Medical practice is itself is a big thing. And saving a lot of people. And, day and night, 24 hours, 48 hours, we are in a dilemma. We are just sitting at home, but the real warriors are these doctors. And still, why people, the patients or their relatives, behave very rudely to them. I personally feel they are next to God. Like you say, mothers are next to God. I say they are next to God because they are the real people who save the patient. They give the hope. And I, being in Delhi, I've seen, a lot of things. There was shortage of cylinders, there was shortage of, vaccine and all that. But we, as a, as a society, we day and night, we from our pockets, we did our best we could do, and we provided whatever we could do. And with the grace of God, a lot of people recovered. Though many had lost hope, but still there was a hope that God is there and they will. And even my father in the first COVID time had gone to the hospital and there was no room. And I literally had to, wait for 7-8 hours to get him admitted. And I got it done. And I helped other patients also. And I personally, requested doctors, the owners and all that hospital to kindly take care of every patient. And to the nurses, I told them, see, these are, patient, not only patient, but they are real. You have to take care of them. So all this went, very smoothly. And today we are in 2022 and in the second quarter, and I hope that things will improve. And, we as poets, give the hope. Our words are so powerful that it inspires. Of course, doctors are there, but, the poetry is something which brings, a lot of, a kind of healing to the minds, to the soul. Every soul needs that, whether it's a doctor or a lawyer or from any profession. So my best wishes are there, and I hope the things will improve. And your Grifin publication, of course, it will rise. It will take it to the dizzy heights.
Thank you so much. We have a social
Anything I
motto.
can.
Thank you so much, sir. So coming to Kala, you are into the corporate world. So how do you see doctors? Because in the corporate world, we were all working from home, and we suffered. But at that time, only doctors were to our rescue. Yes, Kala, can you hear me?
Yeah. So
what do
yeah, so some of my very close friends are doctor. While me being a computer engineer, I had the privilege to work from home. And even though certain professions took a hit, fortunately we did not face that kind of impact of COVID, professionally speaking. But most of my school friends are doctor, and I hear their stories about their COVID duties, the kind of trauma that they undergo physically and mentally too. Because it is so demanding. Once you finish your COVID duty, you can't just come to your home. Even if you come, you're always skeptical whether you're going to infect your family members. That causes such a huge trauma, and I think that is the time I soulfully felt the kind of respect for the doctors, because I cannot imagine myself going through so much of mental pain to go to work and return back every day. Until then, we all I've also felt sometimes that maybe calling doctors a god or beyond God is a glorified statement. But during the COVID, I could feel that nobody in the world would put others' health and needs before them and their family members. So, I'm very grateful that we have such wonderful doctors in the society, and I'm also happy that the kind of support that the doctors got from the family members as well as the government in terms of providing them with the necessary equipments when we compare it with certain underprivileged countries. So yeah, hopefully, like we have got the vaccinations, and I hope even if we have the fourth wave or something, it is not as havoc, like it wouldn't cause that much of a havoc like the second wave, is what I hope. And yeah, that's my opinion, Osmi.
Thank you so much. So here the last lines of the book written by me, of course, those hands that heal are the hands of God on this earth as saviors to the existence of every living being. And we bow down in gratitude for their promptitude in their services, sacrificing their comforts in silence. So thank you so much, dear doctors. And this book is dedicated to all the doctors, all the health workers. And of course, thank you so much, dear writers, for, taking part here and contributing, writing, and making this book success. I would like to thank Dr. Sadhana ma'am for her presence here. Although she had technical difficulties and glitches, she could manage. Thank you so much, Dr. Anup sir. I know you are very busy. He had engagements and all. He is busy in his work. He is a doctor, of course, he has to be. So thank you so much for your presence, sir. I also thank Dr. Rajadhyaksha ma'am. She's extremely busy again. We find her working day and night. Thank you so much for your presence. And I thank all of you, all the co-authors and our guest present here today for making this event successful. We have kept it limited to a few members because of the continuous disturbances of like outsiders. During the events, we get disturbed by people who do not want the success of the events. So we have invited only the people whom we really want, and rest. This event will be showcased on YouTube channels. I will share the link, and I wish you all a day, and to all of you, have a wonderful day. Thank you so much, everyone. And I will share the link with you so that you can share it ahead. And I wish that our pen keeps on moving and we keep on contributing great work for the generations to come. Thank you so much, everyone.
Thank you so much, Masumi, and wishing you all the very best.
Okay, thank you
so
very much to all of you, and happy Mother's Day to all mothers here.
Thank you.
Happy Mother's Day as well.
All the best. God bless.
Okay, thank you.
Congratulations, Jayendra.
Thank you.
Thank you.
Please take a screenshot.
We are taking screenshots. Sonu Kumar is here. He is a journalist. So he's he is a quiet and silent listener. Okay. So screenshots are taken. Okay. Thank you so much, everyone.
Okay.
See you again.
Thank you. Bye-bye.
Thank you. Thank you from Grifin Publication.